All right, my name is Edwin, and I'm doing the subcutaneous injection remediation. Uh, First, let's get our supplies. I have a plastic needle container, dispenser, a plastic needle container. Got my hand sanitizer. I got my gauze. I got my alcohol swabs. I got my gloves. I got my medication. I got my patient. First, we're gonna verify the doctor's orders, and we're gonna make sure that we have the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. And then we're gonna compare the EHR with the MAR. And it says that we are giving 1,000 units of, we're gonna give heparin at 1,000 units a day, starting now. So once we have that, we're gonna compare we've already compared it, so now we're gonna make sure that it compares to the MAR, and we're gonna do the calculation. So it comes out to, we have on hand 10,000 units of heparin in 10 mLs. So calculated, we're gonna be giving is 1 ml of 1,000 units of heparin to our patient. We're gonna get all our supplies together, and we're gonna go into the patient's room, knock on the door, close the door behind us for patient privacy, and we're gonna introduce ourselves to the patient. Hi, my name is Edwin, and I'm here to your provider put in an order for a subcutaneous injection. So before we start, we're gonna make sure we have the right patient and the two patient identifier. So can you please state your full name and date of birth? All right, the patient stated their full name and date of birth. I'm gonna verify it off their armband. They are who they say they are. All right, before we start, do you have any allergies to any medications, food, or seasonal allergies? The patient states that they don't have any allergies to any drugs, food, or any seasonal allergies. So, like I said, the provider, and now I'm going to explain to the patient what the injection is for, and so your provider put in an order to give you 1,000 units of heparin a day. With heparin is a subcutaneous injection that is a blood thinner to prevent blood clots or from forming in your blood vessels. And when I administered this injection, you might feel a sting or a burn, which that is normal. It goes away within time. But common side effects is that you might get easily bruised, and if you fall and get hurt or get an open wound, there's increased bleeding time. Adverse effects is that you might have black starry stool, or blood in your vomit. If this happens, please let us know. Now, before I can start, do you have any questions for me? No questions? All right. The patient has no questions. I'm going to perform hand hygiene. Put on my gloves. Now, I'm gonna open up my alcohol swab and clean up the top of my medication. I'm gonna let it air dry. Put that to the side. Now, while it's air drying, I'm gonna draw up I'm gonna draw up 1 ml of air. Now I've drawn up 1 ml of air and I'm gonna insert it into my medication and put the air in, invert the meds, all right. Take out any air bubbles. Bring it to the camera. Can you see it's 1 ml? All right, now do the one-handed scoop. Cap my medication. All right. So since this is subcutaneous, we could do the lower abdomen, the back of the arm, or the lower thigh area. And we're gonna today we're gonna do subcutaneously in the lower abdomen. So we want to inspect for any bruising, any inflammation, any blemishes, or any wounds. We also want to palpate the area to see for any tenderness. All right. So next, we're going to pinch the skin to make sure that we have the needle, to make sure the needle goes at least 1/2 inch of the skin fold, which it does. All right. Next, we're gonna clean the area. In a circular motion. Sorry, from the inside to the out with 5 centimeters. And we just let it air dry. Then we take our needle, we hold it like a dart with our 2 fingers. Now the skin is dry. We're gonna go in at a 45 to 90 degree angle, and we maintain it and we keep holding it, and we insert the needle and keep inserting for 30 seconds. 30 seconds, and we keep holding. We keep holding for 30 seconds. And we hold it, and then we remove. We discard. We put our gauze, and we keep it there. If it keeps bleeding, we just let it air dry. In the meantime, I discarded my needle. I could pick up all my stuff, all my trash, get rid of my trash, remove my gloves, perform hand hygiene, and then I'm gonna go and document the EHR that I had the right medication, the right med name, the right dose, time, route, and the right site. I'm gonna document if the patient had any adverse response. I'm gonna ask the patient also to let me know if he has any adverse response. He hasn't yet, so I'm gonna document that. Then I'm gonna make sure that my patient is at the bed is at the lowest position. I'm gonna make sure that they have their call light, and I will thank them for letting me come and assist them today. And do you have any questions? All right, after that, that's it.